Hello, Ms. Williams. My name is Dr. Jones, and I'm a medical oncologist. This is Jane Matthews, a medical student joining me in the clinic today.
It's very nice to meet you.
Nice to meet you.
I reviewed your records, and I see that you felt a mass in your right breast a few months ago. You'll be meeting with the surgeon later today. Am I missing anything?
I think that sounds right, but I'm not sure. I also have high blood pressure and diabetes and take some pills for that. What's going to happen?
Typically, for this type of cancer, we would recommend surgery first, which might have to be a mastectomy. And then afterward, we would talk about anti-estrogen medication and possibly chemotherapy. You might also need radiation.
A mastectomy? Chemotherapy? This is a lot. I just can't believe all of this is happening. Am I going to be okay?
Yeah, but that's the only way we can treat the cancer. I'll need to examine you. Any questions, Jane?
She seems scared and overwhelmed. How are we going to help her receive the treatment that she needs?
I've seen many patients like her throughout my career. Given the extent of her disease, she needs a mastectomy, but she'll probably just refuse surgery and systemic therapy. All we can do is make our best recommendation and hope she accepts it.
I'm a little confused. Why do you assume she'll refuse our recommendations? And we saw another patient earlier today in a similar situation and discussed the availability of immediate reconstruction during the mastectomy. You also talked about a possible clinical trial for her treatment after surgery. Are you planning on discussing these options with Ms. Williams?
Well, in my experience, many patients like her don't end up accepting our recommendations for one reason or another. They say no, and we move on. A lot of these patients don't trust the medical system, so I don't even bother suggesting clinical trials to them. And I'm not entirely sure they will understand the details of the trials anyway. And I'm not sure about immediate reconstruction for her, but sure, I guess that might help.
Would it be okay for me to start the discussion? It would give me the opportunity to talk about treatment options, assess her barriers to care, and explore her goals.
You raised some excellent points. Let's go back in the exam room and get started.
Ms. Williams, Dr. Jones and I realize that we may not have fully understood your concerns or addressed them. So before Dr. Jones examines you, could we talk about that?